first, thanks for the invitation to do this interview today. It was a big honor to speak about choosing wisely oncology in Brazil, the Senegal ecancer meeting. It has been a pleasure to work on building this 10 recommendation to deliver evidence-based cancer care in the country. I'm not sure if everyone is aware, but Brazil is the largest country in Latin America, South America, and has a high incidence of cancer. There's an estimate of 625,000 new cancer cases for 2020, and this was an increase of about 20% compared to 2012. So that's why we think it's important for us to understand how we are delivering care and how we are delivering high value care. So the Brazilian task force was a planned initiative of choosing wisely, based on the success of other initiatives around the world. Correct. Our aim was to identify low value, unnecessary, and harmful cancer services. And this was like a majorly medical driven exercise in the country, that we put like a group of people together with patients and all the other stakeholders, such as advocate, policymakers, to actually start a conversation and actually promote high quality care with affordable access to medication. We know that during the past decade, cancer treatment has become increasingly more complex and also expensive, which is bringing considerable impacts on health economies. And at some point, we have interventions that they don't actually do good to patients, meaning they can harm or they can either not increase overall survival or quality of life. So with the Choosing Wisely task force, we were able to bring together people, and based on the Choosing Wisely principles that include evidence of low value or risk harm interventions, high frequency of use, cost, clarity, relevance to the Brazilian context, and feasibility for implementation. We were able to build like a top 10 recommendation list of things that should be avoided. The creation of the Choosing Wisely list for us, it's first step of a multi-phase process to combat low value care or potentially harmful practices in Brazil and elsewhere in Latin America. And now we are undertaking national surveys to describe the infrastructures and the barriers to provide high value care. We are also looking on barriers of implementations and how we can make the recommendations to reach patients. We also plan to expand our Choosing Wisely campaign implementation in the country, and actually we want to serve as inspiration and benchmark to other countries in Latin America. Working with this task force was very inspirational to me, and also helped us to create connections to build strong bonds between different stakeholders in the country. And finally, to build like a list that we are all now looking at a list, and we are planning future endeavors. So hopefully that people will get more inspired, people will start to think more, and potentially bring common sense back to oncology. Because there is this understanding that it's only access that is a problem in low and middle income countries or up middle income countries. But sometimes it's not only access, it's access and also the delivery of high value care. And I'm thankful for this conference and for the Cancer Group to give me the opportunity to present our findings, to discuss our list in the context of the Brazilian region, and hopefully to serve an example and inspirations for other people in the region and other regions to start promoting choosing wisely in their countries, hospitals, departments, because in the end of the day, our aim is to regulate or to promote better care so our patients will have better outcomes in the future.